I rise mostly to speak to the comments that have been made by Senators Abler and Jasinski and that I've heard from home watching the proceedings over the last couple of weeks. I haven't been coming into sessions, Mr. President, and that is because on my shifts I regularly enter the rooms and care for patients directly who are actively ill with COVID-19, coughing and septic and febrile. I didn't think it was a good idea for me to come in and expose other members and their families to my level of risk. Furthermore, I think the entire fact that we can congregate here violates the spirit and the letter of Executive Order 2035, advising us to stay in place. Nevertheless, I come in because I think it's important that you know, that my colleagues know the experience of healthcare workers where I work, and you can factor that into the decisions you make going forward. I would just counsel us all to summon the virtues of caution and skepticism and a bit of military planning as we move forward. You know, this all started with the president saying that everyone who wants a test can get a test. And I don't bring that up to be a smart aleck or to score points, but it rankles still because I still see patients in the emergency department regularly who come in and are afraid and are febrile and have had a cough and have body aches, and they don't get a test because they don't have enough. And they go home with advice to take care of themselves and sequester themselves, drink lots of fluids. If they have trouble breathing, give us a call back. They're afraid for their families, they're afraid for their children, and that is the very best medicine we can offer them. We don't have PPEs to give them, personal protective equipment, we don't have a vaccine or an advised medicine. Members, that's how medicine is practiced in the most primitive and impoverished nations in the world, and that is now how medicine is practiced in the heart of downtown Minneapolis, a stone's throw from the University of Minnesota. That is what we are come to with this illness. Yesterday, our ICU admissions for COVID-19 jumped in one day by 24%, members. Jumps in ICU admissions reflect the behaviors that we were doing as a society 3 weeks ago. So this is the ripple from what we were doing and how we were behaving 3 weeks ago. I want you to reflect on that when you consider your advice for our changes in activity today. If we were to continue a 24% daily increase in hospital ICU beds for COVID-19, we would overwhelm our current ICU capacity in 1 week, and we would overwhelm our reserve ICU capacity in 2 weeks. That is when, members, that is when young doctors, younger than me, start making decisions about who gets a ventilator and who must stay on the floor and die. Those are extremely real decisions, and they will be made if we don't do this right. Furthermore, at the Hennepin County Medical Center and across Minnesota, we are running short on sedative drugs. Simple sedatives for that when people go on a ventilator, they don't experience discomfort or awareness of the tremendous trauma they are enduring. So we are faced with the prospect also of putting people on ventilator machines in the ICU who are fully awake and aware of the circumstances that surround them. We do not have nearly enough N95 masks, the type of high filtration mask you see on my arm. So people are going, staff members, custodial workers, food service workers, nurses, doctors are going into rooms with people with COVID-19 who are coughing with a simple face mask, which we know does not have the filtration capacity to filter viruses. They're going in there because it's their job, and they're going in there afraid. A young woman physician on my service wrote a group email to all of us, which we're sending these days to sustain each other. She wrote one yesterday talking about how she had lost a patient earlier this week to COVID-19, died in the ICU, died alone because we can't have guests in the hospital these days, died alone. And for the first time in her brief career, she broke down in the ICU and cried. She was sad for her patient. She felt helpless. She was afraid for her husband and her 2 young children at home. I hear stories like that, and then I hear that we have national and state leaders saying that medical staff are stealing or diverting personal protective equipment. I hear people say that hospitals and staff are exaggerating or even falsifying diagnoses to manipulate people or to grasp power or to line their pockets. We've heard Leaders say that we are going overboard on how much we use personal protective equipment and people are using them unnecessarily. I would ask and implore this body not to speculate recklessly either about motives or the trajectory of this illness, and do not undercut the recommendations of the CDC in this. I value and honor the advocacy that you have for your local golf course. I have one too. And for your local car wash, and for your taverns. And we ultimately do have to open our economy. We know that economic hardship for Minnesota families is a threat to this state in the same way that the virus is. But we can't open it with Panglossian projections or by accusing healthcare providers of greed and chicanery. You know, it's often stated that this is a military-type situation. We're soldiers on a field against a united enemy, and I think that's an accurate analogy. I would say that if this is a military operation and we are in a war against COVID-19, and this was the Civil War, we're at Bull Run, people. We are in April of the first year. We've had some minor losses, but we have big battles ahead. I would also say the military operations are best carried out when all the soldiers agree and sustain the same objective, when they work in harmony, and when there is unanimous organization, as there was at D-Day with Eisenhower. We need to all be rowing the boat in the same direction. We can open our economy, but we can only do it, Mr. President, when we have adequate testing capacity, which we do not have now, and when we have adequate personal protective equipment for the workers that are going to go out there and do it. Mr. President, Minnesota is well reputed to be the smartest and the healthiest and the bravest state. The spirit of Minnesota is always ennobling and elevating. We have seen moments during this period of singular tenderness and optimize. I've seen the interns on my internal medicine service create a fruit basket and a gift basket for the custodial workers who have to come in and pick up the robes that we cast off after we enter a room. Minnesotans are looking out for neighbors. That's what we do, and that's what we're doing best in this time. Mr. President, I would ask members in the chamber to bring down the temperature, bring down the rhetoric, and let's work together to do this right. Thank you.